It is seen anyone has to ask a question to a doctor. 8 out of 10 times, it is not concerning a prescription, but a doubt one may have in his or her own mind about a health issue or something you heard. Well, for all such doubts, all such queries, we are here at Dr. Saab, Hindi on Wednesdays and English on Fridays. Do subscribe and share our podcast to your contacts and friends. Today, 1st December, is the International AIDS Day. Now, although currently the HIV AIDS epidemic has been brought under good control, there is always a risk of any one of us contracting. So we thought we will devote today's podcast to HIV AIDS. So the first question that is asked to us doctors, are HIV and AIDS synonyms? The answer is no. They are not synonyms. Then you will ask, okay, then what is HIV and what is AIDS? HIV is the human immunodeficiency virus. It is the virus which causes deficiency of immunity in human beings. And this virus, once enters your body, anyone's body, is there for life, and if it progresses without proper treatment, then it causes AIDS. Now, what is AIDS? AIDS. Let me enlarge on that. A is acquired. That means something which you are not born with, you acquire later in life due to your actions. I is immunity, D is deficiency. AIDS, immune deficiency, S is syndrome. Now, what is a syndrome? Let me give you a corollary of a floral bouquet. A bouquet of flowers has multiple flowers of different kinds. Similarly, when you are having any problem of lungs, you will have symptoms of the respiratory tract, like people who had COVID will have fever, cough, shortness of breath, etc. People who have stomach infection, they will have diarrhea, vomiting, fever, pain in abdomen. So when you have multiple systems involved, if a patient has stomach involved, lungs involved, bones involved, and as a cancer, that is a syndrome. Problems of multiple systems together. And that is AIDS, AIDS. So HIV is the cause. AIDS is the end stage disease if HIV infection is allowed to control without proper treatment. Now we come to the question, how does it spread? How am I going to get HIV if at all? So there are three main ways. One is unsafe sex. It could be vaginal, it could be anal, or it could be oral. Any unsafe sex without the protection with a person who is HIV infected is the highest chance of HIV transmission. Second, using needles from infected individuals, which can happen in IV intravenous drug users, which can happen in clinics where doctors do not use disposables, which can happen in tattoo parlors who do not use disposable or well sterilized needles. And the third one, in addition to these contaminated needles, we also have contaminated blood and blood products. But nowadays, fortunately, every blood bank in the country is checking the blood they give you for HIV in addition to hepatitis B and hepatitis C. The third is mother to child transmission. If an infected mother conceives, then the child can get HIV through, because the fetus, the child in the womb, shares the blood circulation of the mother. These are the three ways. And question now is, how does HIV affect me? So when HIV virus enters our body, initially you get a flu-like illness, fever, body pain, little malaise, fatigue, which may get corrected on its own. But then the virus remains in the body. This virus affects us in the way that it destroys our immunity. It not only reduces, it destroys our immunity. There is one particular cell in the body that is called CD4. This is one of the prime cells of our immunity that protects us. Now, HIV virus destroys this CD4 and CD4 count becomes less. The patient now is vulnerable to infections, and these infections mainly are called opportunistic infections. Opportunistic, like you have a house and you put a latch on the door. That is your immunity. You are protecting your house from thieves, robbers. One day, you do not latch your house. You are giving an opportunity to the thieves and robbers to come in and rob you. Similarly, if my immunity is not there or very low, infections will enter my body, and the common cold also can give me pneumonia. Then there are certain infections which are very specific to HIV positive patients. There are certain cancers which are specific to HIV positive patients. So the problem occurs is that we are vulnerable to getting infections because our immunity is very low. Then comes what is treatment. HIV virus is not an easy virus to kill. And it is not self-limiting like COVID was, that if it is a mild infection, it will go away. HIV virus, the best treatment is to prevent it. How do you prevent? Safe sex, especially if it is sex with an unknown partner. And for that, I would request you that if you consume alcohol, make sure that you do not get drunk, because most of the unsafe sex happens when you are not in your own senses, you are under the influence, and you do not take rational decisions. Secondly, avoid, of course, we should never use drugs of pleasure, but intravenous drugs avoid. And if you are going to get tattooed, make sure that the needles are either disposable or they have been sterilized well. If an HIV positive mother conceives, she can contact the doctor, disclose her status, and she can be treated in such a way that the child does not become HIV positive. Then there are 3 drugs which are given. I will not go into the details of treatment. There is a 3-drug cocktail given to HIV patients. Main thing is supportive treatment. If you are taking HIV treatment or somebody in your family is taking HIV treatment, make sure that the person is receiving enough nutrition through antioxidants. Antioxidants help you retain your immunity, and the best way to take antioxidant is colored fruits and colored vegetables. So I can say in one line, when you go to market, wherever you see color, you think of antioxidants. So green cucumber, red tomatoes, watermelon, oranges, spinach, broccoli, brinjal, all bright colored fruits and vegetables contain antioxidants. 3 to 400 gram a day of these salads and fruits with curd and milk give you sufficient immunity. I will give you an example. About 25 years ago, when HIV medicine was not affordable, I could take a poor patient up to this level, retaining her immunity. She did not lose even 1 gram of weight for 1 full year till the medicines become affordable, and now 25 years later she is healthy. Of course, she has age-related problems like blood pressure and all. HIV wise she is healthy. We are monitoring her. We are treating her regularly. So compliance is very important. Treatments are available for free now at government centers. There is a total confidentiality assured. If anyone is taking treatment, make sure they are complying rigidly, not stopping treatment without any reason unless the doctor tells you to change the treatment. I hope this will give you enough tips to make sure that you are not infected with HIV ever. So friends, follow us on our podcasts to get information about future episodes and circulate among your friends. Also, come back to us if you have a query about anything that we have covered or we have not covered so far. Thank you.